this is Jazmine Ramirez. I was in charge of finding a current event for Chapter 12, Cost, Access, and Quality. Cost control efforts in the U.S. are characterized by a combination of government regulation and market-based competition, or more like a payer-driven competition. Due to the fragmented approach to cost control, this allows providers to shift costs. This being said, the main cost control of the ACA concentrated on the Medicare payments being cut to providers, meaning the reimbursement was much more tight. Yet providers charge higher prices to private payers to make up for this lost revenue, which in turn raises premiums for employees, which has led me to this article by the New York Times. Many hospitals charge double or even triple what Medicare would pay, by Reed Abelson, which was published in May 9, 2019. The article illustrates how many hospitals around the nation are trying to make up for revenue loss due to tight Medicare reimbursement by charging their private insurance patients 2 to 5 times as much. Unfortunately, for employers that provide these benefits to their employees, they're basically going in blind into the market, not knowing exactly what they're paying for or why they're paying so much. This adds fuel to the Medicare for All proposal that has been going around in the debates. Some argue that costs would go down if we would be able to pay at Medicare rates. Most businesses have felt that they have been signing off blank checks for insurance companies, and with soaring medical costs, more and more of this burden is actually being placed on the employee themselves. And for even some people, their co-pays are about $950 compared to what they were maybe a couple years ago before the ACA. Some employers are suggesting only paying the reimbursement to Medicare rates, while the General Counsel for American Hospital Association stated simply shifting to prices based on artificially low medical payment rates would strip vital resources from already strapped communities, seriously impeding access to care. In effect, closing many hospitals in rural areas compared to urban, which goes back to our current event from Chapter 11, where rural areas are already being affected, having their hospitals be closed, and now having this kind of cost control yet impeding access is kind of the debate that's going back and forth, and I believe it is definitely a debate to have. But in the end, the purpose of this research was to better arm employers purchasing the right insurance through quality reports, and now they have better standard of prices, not to limit access to the employees, but provide best possible care without losing the bank or quality. Again, this brings up the question, can the U.S. market become more effective or efficient, or do we need a single payer? I do think this coincides greatly with what we read in Chapter 12, just the iron triangle of cost, access, and quality, especially in this time that we are trying to reduce costs. We don't want to lose access for our populations, especially the special populations we spoke about earlier in Chapter 10, and also we don't want to lose quality just because one of the debates against Medicare for All is that if we are charging the smaller rates, then that means that this could impede quality and therefore impede access and greater waiting times, as illustrated in some countries that already have a single payer system. But I do think that there's something that to be looked at, and to realize that there is an issue with cost, and that it would only go up if we don't do anything about it now. So I do think this is something important to look into and to really emphasize in that debate. It's still definitely a debate. It's not a perfect system, and I don't think it will ever be a perfect system, just because of how the fluctuation of society, the fluctuation of cost, the fluctuation of technology, and everything we've gone over this year really impedes in the cost of care, the quality of care, and in the end, the access of care. I do hope that you enjoy this article. It is kind of eye-opening and a little bit upsetting, but it is the truth. And I think there's much to be said, and it's good to know and be acknowledgeable of these costs, especially when we're the ones paying for the medical bills. I was going to also add another article which goes into the cost of Medicare for all, saving billions or costing us billions. I'll go ahead and add that article as well, just because I think it's a good read, and it just adds to the debate and see what we ourselves think about it as well. I'm excited to see what you guys have to say, and I hope that you have a great day.